Hi, hello. Welcome back to our channel. Imagine your brain as the most sophisticated supercomputer ever built, an intricate network of billions of neurons, each firing in perfect harmony to create your thoughts, memories, and every sensation you experience. This remarkable organ is not only the command center for your body, but also the very essence of who you are. It controls your heartbeat, your ability to move, your emotions, and even your dreams. Every decision, every movement, every feeling originates here, making your brain your most precious asset. The brain is the command center for your body, orchestrating everything from the simplest reflex to the most complex thought. It's constantly processing information, adapting to new situations, and learning from every experience. Now picture that delicate organ being suddenly shaken or struck. This is what we call a traumatic brain injury, or TBI. In an instant, a fall, a car accident, or a sports collision can disrupt the brain's delicate balance. A TBI is a physical injury caused by an external force that disrupts normal brain function. It can happen to anyone, at any age, and often when you least expect it. TBIs can range from mild, like a brief change in mental state or a short period of confusion, to severe, where the person may lose consciousness or experience profound lasting disability. Severe TBIs can lead to extended hospital stays, intensive rehabilitation, and sometimes permanent changes in the way a person thinks, feels, or moves. Recovery can be a long and challenging journey, requiring support from family, friends, and medical professionals. A TBI can happen in the blink of an eye, often without warning. Everyday activities, driving, playing sports, or even just walking down the street, can suddenly turn dangerous. The effects aren't always visible. Someone might look perfectly fine on the outside, but inside, they could be struggling with memory loss, difficulty concentrating, mood swings, or even depression and anxiety. The consequences of a TBI vary widely. For some, it's a temporary setback, a few days of rest and recovery. For others, it marks the beginning of a lifelong journey of adaptation and resilience. Some people may need to relearn basic skills, use adaptive equipment, or attend therapy for months or even years. The path to recovery is unique for everyone. The brain's complexity means that an injury can ripple throughout the entire system, altering not just physical abilities, but also thoughts, feelings, relationships, and the way a person interacts with the world. Understanding TBI is crucial, not just for those affected, but for everyone. It helps us protect ourselves and others, and fosters empathy for those living with the invisible challenges of brain injury. TBI is a major public health issue, affecting millions of people every year across the globe. It impacts individuals, families, and entire communities. By demystifying TBI, we can foster support, encourage open conversations, and learn important prevention measures, like wearing helmets, using seatbelts, and making our environments safer. Knowledge truly is power. By understanding and protecting your brain, you're investing in your future, your well-being, and your ability to live life to its fullest potential. TBIs often occur in everyday situations where our heads are at risk. Falls are the most common cause, especially for young children and older adults. Even minor incidents can cause the brain to slam against the skull, leading to injury. Vehicle accidents are another major source, with sudden stops causing the brain to collide with the skull. Helmets and seatbelts are crucial safety measures. Sports, especially contact sports, carry TBI risks. Recognizing concussion signs and removing athletes from play is vital. Violent causes like assaults and military injuries also contribute to TBIs. Each cause tells a story, reminding us of the need for prevention and treatment. Understanding these causes helps us protect ourselves and others. Traumatic brain injury, or TBI, can dramatically change a person's life in an instant. The symptoms of a TBI can affect every part of who we are: our bodies, our minds, and our emotions. These changes can be sudden and obvious, or they might be subtle and develop over time, making them harder to recognize at first. Physically, someone with a TBI might lose consciousness for a few seconds, or even hours, feel dizzy or unsteady, or experience persistent headaches that don't go away easily. Nausea, vomiting, and sensitivity to light or noise are also common physical symptoms, but the effects go beyond the body. Cognitively, a person may feel like their thoughts are moving through fog. They might struggle to focus on simple tasks, forget recent conversations, or find it hard to organize their thoughts. Everyday activities like reading, following directions, or remembering appointments can suddenly become challenging. This can be frustrating and isolating for both the person with the injury and their loved ones. Emotionally, TBIs can lead to mood swings, irritability, anxiety, or even depression. Some people notice changes in their personality, feeling less like themselves or more easily overwhelmed by emotions. It's important to remember that these changes are a direct result of the injury to the brain, not a reflection of someone's character or willpower. The symptoms of TBI can vary widely. Mild TBIs, like concussions, might cause only subtle changes, such as brief confusion, mild headaches, or slight memory lapses that can easily be overlooked. In contrast, severe TBIs can result in long-term unconsciousness, significant physical disabilities, and the need for extensive rehabilitation and support. Recognizing the signs and symptoms early is crucial. If you or someone you know experiences a blow to the head and starts showing any of these symptoms, it's important to seek medical attention right away. Ignoring symptoms or delaying care can make recovery much harder and may even lead to permanent complications. Every TBI is unique, and the path to recovery is different for each person. Understanding how TBIs affect people helps families, friends, and communities provide the right support and encouragement. Early intervention and proper care can make a significant difference in recovery, helping people regain their abilities and confidence. The journey of healing after a TBI is often long and requires patience, determination, and hope. With understanding, support, and the right care, people affected by TBI can move forward and rebuild their lives. Understanding traumatic brain injury, or TBI, begins with examining how the brain responds when it experiences trauma. The brain, a delicate and complex organ, is protected by the skull, but it is still vulnerable to sudden impacts or jolts. When an injury occurs, the brain's intricate network of neurons and blood vessels can be disrupted in an instant. The primary injury is the immediate physical damage caused by the impact, much like the sudden shock of an earthquake shaking a city. This can happen in car accidents, falls, sports injuries, or any event where the head is struck or violently moved. During this moment, the brain can collide with the inside of the skull, leading to bruising, bleeding, or tearing of delicate blood vessels and nerve fibers. These injuries can be seen on scans as hematomas or contusions. Unfortunately, this initial damage is permanent and cannot be reversed. It sets the stage for what happens next in the brain's response. After the primary injury, a secondary injury unfolds. This is a cascade of chemical and cellular reactions triggered by the trauma. The body's attempt to heal can sometimes make things worse. Swelling or cerebral edema increases pressure inside the rigid skull. This pressure can squeeze brain tissue, restrict blood flow, and cause further injury to areas that were initially unharmed. Damaged brain cells release toxic chemicals and inflammatory substances, which can harm neighboring healthy cells, spreading the injury beyond the original site. Emergency medical care is focused on limiting this secondary damage. Quick intervention can make a significant difference in the patient's outcome. Doctors work to control swelling, maintain proper oxygen flow to the brain, and monitor vital signs closely. These steps are critical to prevent further harm. The first hours and days after a brain injury are the most crucial. Intensive care during this period can greatly influence the chances of recovery and long-term health. By understanding these complex processes, doctors and families can make informed decisions about treatment and rehabilitation, giving patients the best possible chance for improvement. The brain's response to injury is a delicate balance that requires careful management, constant monitoring, and a team of dedicated professionals. With greater knowledge of each stage of brain injury, we can improve outcomes, support recovery, and help survivors regain their quality of life. Assessing TBI severity requires standardized tools. The Glasgow Coma Scale, GCS, measures eye, verbal, and motor responses. A high score indicates a mild injury, while a low score suggests severity. The Rancho Amigos Scale, RLA, tracks cognitive and behavioral recovery. The Disability Rating Scale, DRS, evaluates long-term progress. The Functional Independence Measure, FIM, assesses daily living tasks. These tools provide a comprehensive view of the injury and recovery. They guide treatment and set realistic goals for rehabilitation. Accurate assessment is crucial for effective care. These scales help tailor therapies to individual needs. Science is advancing TBI assessment with new tools. Advanced neuroimaging like diffusion tensor imaging maps brain pathways. Blood tests detect specific proteins released during brain injury. Computerized neurocognitive testing measures cognitive functions. These innovations provide detailed insights into brain injuries. Virtual reality and telehealth offer new assessment possibilities. VR creates controlled environments for skill assessment. Telehealth connects specialists with patients remotely. These advancements make TBI assessment more precise and accessible. New technologies enhance understanding and treatment of TBIs. They offer hope for better diagnosis and recovery. The future of TBI assessment is promising and evolving. TBI assessment is a continuous journey, evolving with recovery. In the acute stage, the focus is on survival and stability. The GCS and CT scans guide critical decisions. In the subacute stage, understanding deficits shapes therapy plans. The RLA and FIM set recovery goals. In the chronic stage, the focus shifts to reintegration and monitoring. The DRS tracks long-term progress. Advanced assessments aid in returning to daily life. A dynamic approach using various tools is essential. Comprehensive assessment guides treatment and supports recovery. It ensures personalized care for TBI survivors. Remember 3 truths about TBI uniqueness, recovery, and assessment. Every TBI is unique, requiring personalized treatment. Recovery is a marathon, with progress in small steps. Patience and persistence are essential for families and survivors. Assessment is the foundation of effective care. It involves using the right tools and listening to survivors. Good assessment leads to targeted treatment. These principles guide a compassionate approach to TBI. Behind every diagnosis is a person profoundly changed. Understanding these truths fosters empathy and support. They remind us of the human story in every TBI. Our goal is to provide the best tools for rebuilding lives. Concluding our TBI exploration, balance complexity with hope. The brain's potential for healing is remarkable. Advances in TBI science bring new diagnostic and therapeutic strategies. Community awareness is growing, reducing stigma and isolation. Supportive environments aid recovery alongside medical interventions. Survivors and families are not alone. Support networks are available. The path forward may differ, but it can be meaningful. Healing involves discovering strength and resilience. Knowledge empowers advocacy and prevention. Recognizing injury signs and seeking help is crucial. Compassion and belief in potential guide recovery. With hope and science, we navigate the TBI journey together. Thank you for watching. Help others by sharing this who need it. Do subscribe for more updates.